Okay, get myself here. Okay, so first of all, my name is Sheree Sandrock. I am the Executive Director of the Down Syndrome Association of Pittsburgh. Thank you so much to everyone for joining. We are so excited to have Nancy Murray with us here today. Nancy, and I'm going to read this because I'm not going to remember all of this. Nancy Murray was one of the founders and the first director of the Down Syndrome Center at Children's Hospital of Pittsburgh. Very exciting. The president of the ARC of Greater Pittsburgh and a senior vice president of Achieva. She has successfully worked on legislation, policy development, and fundraising for the closure of state institutions, Medicaid home and community-based services, access to care, and services for children with adult and with complex issues. She is currently the advocacy liaison for William Penn Human Services, chair of the Providers Alliance Government Affairs Committee, board chair of the Pennsylvania Assistive Technology Foundation, and a board member of National Task Group on Intellectual Disabilities and Dementia Practices. Nancy and her husband are the proud parents of 3 adult children with Down syndrome, and we could not be more honored to have her here with us today. So I will share my screen and then Nancy, you can take it away.
Okay, thanks, Sharice. Well, let me just say it's my honor to be here today because of all of the jobs I've ever had in my career. Working at the Down Syndrome Center will always be the one thing that I am the most proud of. And just to see, where the Down Syndrome Center, uh, is today. It's known nationally, internationally, I should say. And my little Down Syndrome Association has grown into such a wonderful organization. I could not be more proud. So today we're going to talk about the proposed Pennsylvania executive budget, which would start July 1st of 2026, if we are so fortunate. So on February 3rd, just a few weeks ago, Governor Shapiro unveiled what this year is a 53.3 billion, with a B, proposed budget. And that is a 5.3% increase over last year's budget. Keep in mind that last year's budget was only signed into law 4 months ago. Usually budgets are signed into law sometime in July of each year. But the 25-26 budget, unfortunately, was not signed because we were enduring a 135-day budget impasse. And as I'm sure many of you know, as soon as the budget is given, that's what really formally kicks off all the budget negotiations. And hopefully we will meet the June 30th, 2026 deadline. Many of us believe we'll be close to that. A couple of reasons. We have a governor who may be running for, the Democratic nomination for the presidency. We also have half of the Pennsylvania senators who will be on ballots, and every Pennsylvania House member will also be running for reelection. So given that, every House member and half the Senate need to be back in their districts running their campaigns, we believe that we could be very close to a June 30th deadline. So let me just also say that following the budget address, as you might imagine, Democratic lawmakers got in line and said they fully support the governor's plan. And within 10 minutes, we were reading where Republicans were pushing back against the plan, saying it would spend too much of the state's savings. Many of you probably know that our savings in Pennsylvania are put into what we call the Rainy Day Fund. And Republicans quickly had done the math to figure out that in order to pay for the 53.3 billion dollar budget, the governor would need to dip into the rainy day fund by at least $4.6 billion. So let's talk about some of the basics about the budget. The next steps are each of the departments, the Department of Human Services, the Department of Education, the Department of Agriculture, all the departments during the months of March and April will appear before the House and the Senate appropriation committees. In fact, next week, oh, go back, Sharice, I was just doing that. In fact, next week we have the most important one for the work that I do, and that's the, can you go back to? And that's the Department of Human Services. During the hearings, the House and Senate Appropriation Committee members will have the opportunity to ask each of the secretaries of all the departments questions. So, for example, yesterday I sent my state senator two potential questions that he might want to ask during the Senate Appropriation Committee hearing on the Department of Human Services. Following the hearings, we need to go back a couple more. Sharice, I think it's maybe 3. Oh, now go one more forward. Then we're on 4. There we go. Following the hearings, the House and Senate Republicans and Democratic leaders will start to meet to hammer out the final budget. Now, what's important for everybody on the call to understand is that your House and Senate, your House member and senator will have the opportunity to talk to their leaders about issues that are important to them. So don't think that all of this happens way up here. Your House member, your senator will have the opportunity to meet with their leaders to push issues that are important to them. And we're going to come back to that again in a few minutes. Okay, Sharice, now we can move forward. So in the budget, there's a lot of the new spending. Half of the new spending would be in the human services budget, as you might imagine. Healthcare, for food assistance, child care, and the services that we care most about, all disability services. So that's where a lot of the governor's proposed new spending is going to be. Governor also is proposing an additional $565 million for school districts. And this is all based on the adequacy gap, and we'll get to that in a few minutes. He's also proposing $300 million more for public transit agencies, especially in Philadelphia and Pittsburgh. And then a $1 billion infrastructure program for housing, energy, and other capital projects. One thing I do want to mention here, just last week, Governor Shapiro unveiled a 10-year housing plan and housing projects for people with disabilities was one of the highlights of the plan. I was invited to meet with the First Lady and a couple other advocates in a couple weeks, specifically to talk about what we need when it comes to housing for people with disabilities. And then I'm sure you've read or heard that the governor continues to support raising the minimum wage to $15 per hour. Keep in mind that all of the states surrounding Pennsylvania have a much higher minimum wage than our $7.50 minimum wage in Pennsylvania right now. Next slide, Sharice. Okay, so how are we going to pay for all of this? Right? That's the question that Republicans are asking. Well, you probably, have heard something about this also. The governor and members of the Democratic caucus are pushing for taxes and licensing fees on recreational marijuana, taxes on skill games that you find, at casinos and, convenience stores, those sort of things, and then closing the corporate tax loophole. So far, and I think this is now the second or third legislative session, the taxes and licensing fees and the taxes on skill games have gone nowhere. So their bills have been proposed, but so far we have not seen any taxes passed on those things. Not to say it can't happen this year, but so far not so much. Okay, let's start to talk about the things that are most important to parents of children with Down syndrome and other disabilities. Early intervention. So for the children ages 3 to 5, that's Part B, early intervention, the budget calls for an increase of $51.2 million. However, the next 5 words are very important. To continue the current program. That those $51.2 million are not proposed to increase services, enhance current services, bring in new services. This is to continue the current program. The reason is the number of children who are expected to need early intervention. You can see there's a jump there from 74,138 to 76,638 children. So, even it's continuing to continue the current program, but there's quite a few additional children that are going to have to be served within the current program. At least there's a proposed increase there. For the infants and toddlers Part C program, the budget actually includes a $5.2 million decrease. That $5.2 million increase will be made up by a decrease from continuing services and 1.6 million. And this is where it gets a little wonky. I don't want to spend too much time on this, but our federal match, our FMAP in Pennsylvania will increase next year, meaning the state portion of certain Medicaid services can be lowered, and that's what they're banking on here. We're also thinking that there's going to be an increase in the number of children birthed to 3. In fact, at least another 1,000. How early intervention providers are going to be able to, provide for that many new children with a decrease, well, that's one of the things that many advocacy groups are already starting to meet with legislators about. This is not a part of the state budget where we want to see a decrease when it comes to infants and toddlers with disabilities and developmental delays. Next slide, Charisse. Special education. So according to what we're seeing in the budget, we do not see where Pennsylvania would be receiving any additional federal dollars. And that comes from the Individuals with Disabilities Education Act funding. It looks like it's proposed to stay at $600 million. The state, however, is proposing to increase their portion by $50 million. And the language in the budget is pretty specific. It states that the $50 million would be used for increased resources for special education instruction. What that exactly means, we don't know. That is why there'll be a question, I'm sure, asked during the appropriation hearing for the Secretary of Education to talk more about exactly what that $50 million would be earmarked for. I have not seen the number of students the projected increase in the number of students. I haven't seen that yet. And again, for any private schools, any increase would be to continue current programs, not to increase programming. Now we're going to turn to services for both children and adults. Oh, the adequacy gap. That's right. Back in 2023, state court ruled that Pennsylvania's spending on public education was inequitable and that it actually violated the state constitution. And the judge found that students in poorer school districts, and obviously poorer school districts, cannot raise money through property taxes. But the judge found that these poorer districts were not educating students well enough. So the following year, a bipartisan group of House members and senators came together. They acknowledged this adequacy gap, and they passed a budget that acknowledged that about $4.5 billion would be needed to properly fund these districts. And they pledged to use state dollars to do this. To date, the legislature has appropriated $1 billion towards that $4.5 billion. This year, Governor Shapiro is proposing another $565 million, making making education just after human services the area of the budget that will see the largest increase. Okay, next. Office of Vocational Rehabilitation. For adults with Down syndrome and other disabilities, OVR funds majority of programs, employment programs. We are very disheartened to see that the budget increase is only proposed to be $1 million. This will in no way, shape, or form be able to meet the needs of the people with disabilities who already are in employment programs, let alone the number of students who are graduating in June, people who are looking to, become employed and need services through vocational rehabilitation. This is an area, again, where advocates are already starting to meet with House and Senate members on labor and employment committees. Now we'll turn our attention to the Office of Developmental Programs. And this is where children with Down syndrome, all types of disabilities, and complex medical issues receive their home and community-based services. So this is not education, it's not early intervention, but this is where most of the home and community-based services are provided from. And ODP provides a huge range of services. As I said, for children, adults with intellectual disabilities, autism, they provide services such as life sharing, supported living, residential habilitation, supports coordination. For those of you who already have a supports coordinator, you know that you have a relationship with the Office of Developmental Programs. All day services, employment services, therapy such as OT, physical therapy, occupational therapy, speech therapy, assistive technology, which is a very, very growing service, transportation, nursing, behavior supports, support to participate in community activities, and a lot of other services, the goal of which is to promote independence and community living. And there are other services funded through the Office of Developmental Programs, but these are the major headings of those services. Next, Charisse. Now, these services are offered through Medicaid, and I highlighted and bolded that because it is critical that people understand that these are Medicaid pay, these services are paid for through Medicaid. So when we hear anybody say anything about cuts to Medicaid, we need to listen really carefully because the services that, again, children are accessing these services now, but once somebody graduates from school, enters adulthood, adult services are paid for by Medicaid. And many of your family members may already have a waiver. In Pennsylvania, we've got the 3 waivers, person family directed support waiver, the community living waiver, and the consolidated waiver. So what's the difference between Medicaid and a Medicaid waiver? And I could spend a whole hour just on this. But the way I've always tried to simplify this in my mind and for anybody else, waivers allow states to offer services in the community rather than institutions. That's simple definition of a waiver. And that's why you're also going to see the terminology home and community-based waiver programs. But make no mistake, these are all funded by Medicaid. Next slide, Charisse. So let's take a step back for a second. Medicaid is a program funded by the federal government and individual states. Medicaid provides health coverage, millions of Americans, primarily low-income adults, children, women who are pregnant, elderly adults, and people with disabilities. And Medicaid is income-based. So, your income, your assets have to fall within a certain range for you to be Medicaid eligible. Given the fact that most people with disabilities, and I say most, not all, but most people with disabilities are considered to be low income, that is why most are eligible for Medicaid. So it's funded by the federal government and individual states. That's why the Medicaid portion in Pennsylvania is so high. Because, and it's now I think it's almost 55-45. For every dollar Pennsylvania puts in, I take this back, I think it's 56 now. Pennsylvania pays 56 cents, the federal government pays 44 cents. That's why the Medicaid budget in Pennsylvania is so high. Keep in mind, each state offers different services, different eligibility guidelines, different rules in each state. There are federal rules everybody has to abide by, but then each state is different. Now, federal law requires states to cover certain mandatory services. And as you might imagine, that would primarily be inpatient and outpatient hospital care. States can also offer optional services, and waivers are optional services. So if a state says, yes, we're going to accept Medicaid dollars, that state has to cover the mandatory services. And there is a longer list. They don't have to offer optional benefits. So again, that's why you go from state to state. The list of services that each state offers is different. In Pennsylvania, we have a pretty robust list of covered services. Even though they're considered optional, they're covered services in Pennsylvania. You may be wondering, long-term care services such as nursing facilities, those are also covered under Medicaid. So keep in mind how important Medicaid is to all of those groups: low-income adults, children, women who are pregnant, seniors, people with disabilities. The disability community cannot withstand any cuts to Medicaid. That's the bottom line. So Medicaid will pay for example, an adult with Down syndrome. Medicaid would pay for that person going into the hospital as an inpatient, outpatient services, behavioral health services, and the Medicaid would also pay for all of those home and community-based services like supports coordination, transportation, assistive technology, community homes, life sharing. That's why Medicaid is so important to us. Sharice, the next slide. As I said a few minutes ago, okay, Medicaid also allows states to offer home and community-based services. Okay, this isn't mandatory. This is optional. Okay. And these are the services that allow somebody to get their services in the community rather than an institutional setting like a nursing home. So Medicaid would pay for somebody, to get their services in a hospital, a nursing home, state institution. The waiver allows the state to provide those same services in the community. And that's where the word waiver comes from. You can get your services here in a facility. The state, however, waives the requirement for you only to get your services here, waives the requirement so you can get your services in the community. And that's where the word waiver comes from. The other thing is waiver programs also can offer services that regular Medicaid doesn't offer. So for example, regular straight Medicaid does not offer respite and supports coordination. You get those services through your waiver. So now if I haven't completely confused everybody, let's go a little bit deeper in this because this is also important. The next slide, Sharice, please. There are different rules for Medicaid and waivers, Medicaid waivers. And remember, when we say waiver, we're saying Medicaid waiver. as we said before, eligibility for Medicaid, the rules vary state to state, but most people qualify because they're low income. Waiver programs have additional requirements. Okay. There are still those financial limits. But in addition to qualifying financially for a waiver, a person also has to be evaluated and to show that they require a level of care. And that level of care could be, something in a hospital, a nursing facility, or other institution. So people who receive waivers every year still have to have a physician, psychologist, psychiatrist, etc., someone from the healthcare professions, sign off that that person does still require a level of care that would make them eligible for a waiver program. It's kind of anachronistic, really, but it's a federal requirement. That's why we still have to do it. Now, with Medicaid, the state can serve as many people as are eligible for Medicaid. There's no limit on the number of people who can get their health care through Medicaid. Big difference with waivers. Waiver programs have a limited number, and I've always hated this name, but they're called slots. There is a limited number of slots in waiver programs. And if you looked in the waiver application that Pennsylvania has to submit to the federal government, you'll see for each year how many people can be served in each of those 3 waivers. And that's why sometimes you'll hear somebody say, I have a waiver slot. It's basically I like to call them spots, not slots. Because there's a limit on how many people can be given a waiver. There are always going to be people who are eligible. You're eligible. You're low income. The doctor has signed off, level of care. So you're eligible, but there's no slot for you. So if you're eligible and there's no slot, that's when you're placed on the waiting list. I kind of wanted to give you the background because I think it helps people to understand how we get to certain places. I know it's confusing, but I think it helps people. You have to understand the history, and you have to understand how the system works. Shreets, what's the next slide? So, as of just a couple of months ago, November 2025, across the state of Pennsylvania, there were 7,203 adults, meaning over the age of 21, on the statewide waiting list. And these are people who are waiting for all of those waiver services, Medicaid waiver services. These are people with intellectual disabilities and autism. Large majority of those people of those adults have Down syndrome. Of those 7,203 adults, 3,205 have an emergency need for services. It's almost half. These are people who, large number of those 3,205 are adults now living with elderly parents. So we do have parents in their 70s and 80s, still primary caregiver for their adult son or daughter. We have more and more adult brothers and sisters who are now the primary caregiver for an adult with Down syndrome or other intellectual disability. Some of these people on the emergency waiting list might be living with a single caregiver. Mom or dad have passed away. So a single caregiver. I know a lot of families where there are single caregivers now because mom or dad has either passed away, one or both are pretty incapacitated and find it difficult on a day-to-day basis to care for somebody, or there's been a divorce. In addition, again, as of November 2025, there were an additional 3,831 children. Children are defined as under the age of 21 on the statewide waiting list. And 1,092 have an emergency need for services. So these may be, teenagers, adolescents who are about to graduate or who have graduated from high school, where there is, maybe mom and or dad who need to work, and there's no other caregiver for that person. That person would more than likely end up on the emergency list. So this is why we're spending time on this. Remember, these are people who all of these adults and children, they are eligible for a Medicaid waiver. The Office of Developmental Programs knows who they are. They have their name. They know exactly what services they need. But there is no Medicaid slot for them to move into. Next slide. Now, the proposed budget, Governor Shapiro has put into the budget a request for an additional $76.8 million in state funding. Now, keep in mind that would be almost doubled with the federal Medicaid dollars. So we're looking at, almost $158 million. Now we're awaiting clarification on this because the Secretary of Human Services has not come out just yet and said this, but we believe that 30 million of that 76.8 million, and again, remember, it's going to be matched, that will be used to expand capacity. So increase by 400 the number of consolidated waivers and an additional 850 community living waivers. That would give us 1,250 waivers to help people on that waiting list. We're still going to have a waiting list. We're still going to have an emergency waiting list, but it will help. And every little bit helps. Let's go to the next slide. I want to take a tangent here because, and I know people like Lisa understand this. Lisa could probably do this presentation. All the people we've been talking about so far live in the community. They're you, they're me, they're families like us. Okay. And what a lot of people don't know is that Pennsylvania still has two institutions. People with Down syndrome live in these two institutions. They're called Ebensburg, and Ebensburg, Pennsylvania is, I think it's Cambria County. Selinsgrove is right north of Harrisburg. Right now, about 410 people live in these two big institutions. And the proposed budget calls for a huge increase to serve what by the end of next year might be almost 362 people. 362 people by the end of by June of 2027. Just to give you an idea, right now in the community system, ODP serves about 60,000 people. For each of these 362 people, the state of Pennsylvania will pay about $668,000. That's per person each year. For people, and many of you, have these budgets. People living at home with their families may have a waiver budget of $30,000. Somebody living in a community home where there's, 24-hour staff, their budget might be $175,000. People living in our state institutions are costing $668,000. And I will submit to you that there is nobody living in a state institution that cannot live in a community home. Most of these people now are elderly. I think the average age or the median age is over 60 now. These are elderly people. One of the things that I continue to work on and many advocates are continuing to work on is pointing this out to our state legislators that when we have a waiting list of 7,200 people, more than 3,000 of whom have an emergency need for services, we can no longer afford these costs for so few people in two institutions. So, Therese, let's get to the ending here. What you can do. It's not what you can do, it's what we have to do. Family members, self-advocates, others who care about, our families, it's imperative that we contact our state reps and senators to educate them about all of this. You have to understand, state reps and senators are expected to know about everything. They are expected to know about why there's a lack of salt for our roads. They have to know about agriculture, prisons. They have to know about bridges being renamed. They have to know about, taxes. There is no way, even with the best staff in their office, they can be expected to understand our issues. So our job is to educate them. And you have to make your state rep and your state senator the most educated state rep and state senator in the Pennsylvania legislature. This is our job. And it's not hard to do. So go last slide, Therese. If you don't know who your state rep and state senator are, it is very, very easy. I just did this yesterday to double check it. You just go to that website. You'll see Senate up at the top. You click on it, and then it takes you to find your senator. You just put your address in, hit search, and bingo, the name of your state senator comes up. You do the same thing for your state rep. And Lisa is bringing up a good point. We'll come back to that if we have time. Now, people have always asked me, like, should I drive to Harrisburg? And my answer is no. Schedule an appointment in their district office, and I'll tell you why. When you go to Harrisburg, if somebody doesn't want to meet with you, you'll come in the office and they'll say, I'm so sorry. I've just been called to an important committee meeting. And they leave. And there goes your meeting. But when you have a meeting in their district office, they're stuck in the office with you. There is no place to go. Right? So, plus we don't have time to be driving to Harrisburg, right? We're busy families. So you make an appointment in their district office. And I always say to people, take your family member with you. What better way to teach, a member of the Pennsylvania legislature about what it's like to have a child with Down syndrome? Take your child with you. Take your adult family member with you. Members of the legislature are visited by lobbyists, highly paid lobbyists every day who push their issues. And I can't tell you over the years how many legislators have said to me, I'd rather meet with real people than lobbyists, because they know lobbyists are getting paid. When we go in to meet with a legislator, we're not getting paid. This is what we have to do for our family. So meeting families, hearing our stories, most compelling way to influence legislators. And you don't have to go in with all the numbers that I gave to you today. You just go in and tell your story. So, if you're on the waiting list, you go in and tell that legislator what it's like to be on the waiting list. I can promise you that if that legislator has talked to enough families about the waiting list, that legislator will go into a meeting in Harrisburg And he or she may not remember all these numbers, but they'll go into a meeting, hopefully with the leaders, and they'll say, you know what? One thing we have to do is put more money in the budget for that waiting list because they're thinking about the meeting you had with them. It happens all the time. I know it sounds like, oh, it couldn't possibly happen, but it happens all the time. You all have the most compelling stories, and it's just, what you need for your child, for your brother, sister with Down syndrome. You know, if it's uh, if it's the waiting list, if it's, more money for special education, because in your district, well, you don't have enough aides. You don't have enough paras. Whatever it is that your family needs, just go in and talk with them about your stories. You can also write a letter. You can also send an email because every contact is counted. In the offices, they keep, and it's not fancy in a lot of offices, they keep just tick marks. How many emails, how many letters, how many visits they've had about all of these issues. And I can tell you, because budget season has started, everybody is calling their legislators and asking for more money for whatever their issue is. And we need to make sure that our voices are heard, that they're loud, always be gracious, always be kind, but be loud. And our legislators are hearing about early intervention, special education, and all of those home and community-based services. That's our job. And I'll stop there. Now that I've completely confused everybody, I will stop there. I don't know if anybody has a question. I put my on the last slide, Charisse, I put my email. Don't hesitate to send me an email. If I don't have the answer, I will surely get it for you. Charisse, I'll turn it back over to you.
Nancy, thank you so much.
Thank you so much.
So
That was
wonderful.
Well, as I said, Lisa Silverman could do this. If something ever happens to me, call Lisa.
20
I
years
think-
on Nancy's board, that's what you learn.
Stephanie, you have your hand raised.
Yeah, I didn't want to interrupt while you're talking. I just wanted to thank you, Nancy, so much for this presentation. I thought it was wonderful. I thought it was very clear. I didn't think were confusing at all. And, I feel inspired to take some action. So I appreciate the time you took. And, you did an awesome job. Thank you.
Well, thank you. Now it's everybody's job. It's budget season. So it's everybody's job to go out. Every once in a while I still get, even though I'm retired kind of, I still get calls from people before they're about to go out and meet with their legislator and just say, can I practice this on you? Sure. So if everybody on the call today goes out and visits their state rep and state senator, that will be a huge win for the Down syndrome community. And, for those who aren't on the call today, your friends, get them to go with you or separately, kind of spread the word that we have a lot to lose this year. We need, first of all, we need to protect the money that's already in the budget, but we need to continue to ask for more, or people are going to be waiting even even longer. We don't want that to happen because we got too many people on emergencies. So Lisa, are all the people on the adult in need of consolidated waiver? Not necessarily. There are some people on the emergency waiting list who really could do with a community living waiver because of the services that they need. Not everybody needs consolidated. All right. Think we're good, Charisse.
Oh, I just had asked, can you share any of those slides or the presentation? I mean, you can, keep your name on it or just, I wouldn't mind just some of them about the waivers, just for information. It's not,
I gave everything to Charisse, so
Okay.
she's the tech diva.
Okay.
After, we'll be putting this all on the website, but I will share
Okay.
the link for that, and then I'll share that slide deck there in that email.
Okay. All right. Thanks.
All righty. Thank you so much, Nancy, and thank you for everyone for joining, and have a nice afternoon.
Yeah, you too.
Bye,
Bye.
everybody.